Hello class, my name is Joseph Hale, and I'll be doing my presentation on the emergency planning for nursing homes. I chose a disaster plan for a medical facility because I understand the complexity of ensuring hundreds, if not thousands, of people are cared for, but the majority of them might be having a mobility or other limitations that require the assistance of the staff. Nursing homes and assisted living centers are home to a great number of residents who are sadly might be forgotten by the loved ones, or again suffer from the ailment that relies on others for help. These facilities make the safety of their patients and visitors their number one top priority whenever emergency occurs. The reason why I picked this organization is my grandmother once lived in the assisted living facility for many years in the state of Tennessee, and in that facility she lived at was affiliated with this organization, the AHCA and NCIL, which I'll go over later. The organization I chose for the assignment is the National Center for Assisted Living, NCAL, and the American Healthcare Association, AHCA. Both these organizations are national-wide who specialize in providing training, administrative tools, information, education, and legislative support to healthcare providers. Their headquarters is based out of Washington, D.C., at the address you see on the screen, 1201 L Street on Northwest Washington, D.C. They provide support for over 12,000 nonprofit healthcare facilities and various state association affiliates who, as you see, provide support for assisted living centers, nursing acute centers, and individual homes for those with disabilities. Both these organizations, the AHCA and NCLA, advocates for individuals with special needs, disabilities, traumas, or illnesses that require long-term care settings. And both these organizations are committed to developing public policies which balance economic and regulatory principles to support quality care along with the quality of life for the patients. The first topic I'll go over is preparedness. As you see on the slide, I created a 4-bullet sequence diagram. The AHCA and NCAL both require designated officers to hold specialized billets, which have specific roles and responsibilities attached to them. As seen on the slide, those officers are the safety officer, security officer, and the incident commander. The incident commander is the overall decision-making chairman, on that emergency committee. Both the safety and security officers provide the assessments on the matters dealing with the physical state of the facility, of the personnel, visitors, staff associated with the facility, and are both directly responsible for the lockdown procedures. The organization has then provide the staff at every level with situational education, assistance, and also the creation of the emergency checklist. The third bullet is planning. The AACA and NCAL mandates a shelter-in-place plan as a primary method of response prior to a lockdown or facility evacuation. In case of a lockdown or a full-on evacuation, the incident commander must give the initial approval prior to the full facility evacuation. the incident commander will be considering all aspects of the planning, training, preparation, collaboration, and communication with local authorities, such as the emergency services, police, fire, EMT, and also consider the impact on the patient's staff and visitors' health. Mitigation. The guidelines approved by the American Healthcare Association and the National Centers of Assisted Living require provisional storage of medication, food, water, oxygen, and other supplies for periods up to 7 days with a bare minimum of 72 hours. Each facility nationwide, no matter what kind of healthcare services they provide or a medical treatment, have all adopted some sort of medical emergency, national disaster emergency broadcasting system, which categorizes the events or situations with a color code designation. This color code, for example, code green is could be an active shooter. Code pink could be a abduction of a child. So, although this code system is not standardized across the nation, state of Florida, along with the Florida Hospital Association, recommended a national review and the creation of a standardized national emergency coding system. The incident commander, which is obligated to coordinate with medical, fuel, food, and water vendors to acquire the adequate supply system. The organizations require certain checklists for external support for the specialized equipment, to have external professionals come in, such as electricians, to inspect and operate on the backup power generators. The next topic is response. As I stated in the last slide about mitigation, the emergency code system is designed to alert both the staff and patients on a immediate threat, a emergency, an issue with a facility, with an audible warning accompanied by a color code designation. The color code key must be positioned in a accessible location as a quick reference to each color code. The AHCA and NCAL created specific guidelines to ensure only a select few can authorize a full facility lockdown or evacuation after considering many of the tough decisions I spoke about earlier. Each level employee is given training in all aspects of planning, tasking, supervision during a disaster scenario, and the higher the employment supervisory level, well, that equals a higher degree of training. My last topic of the night is recovery. During an emergency or disaster situation, the incident commander is required by both the organizations to contact and inform the local emergency agencies, such as police, fire, medical emergency teams, regarding all aspects of the decisions that were made. Checklists or step-by-step lists designed to walk an individual through the operation sequence of a piece of equipment or procedures. Storage areas for food, medication, supplies should be equipped with enough provisions to sustain a proposed amount of people for an estimated amount of time. The guidelines are keep storage for about a week with a minimum of 72 hours. And the critical storage equipment, such as refrigerators, generators, other things that require power to operate should be a reasonable distance from a backup generator to prevent any spoiling of the food and medication. And that's my presentation. I hope you guys like it, and hope you learn a little bit about the American Healthcare Association and the National Centers for Assisted Living's emergency plan of shelter in place. Good night.